Jay is half the man he used to be, literally. Jay has lost around 160 pounds in the past year and a half, thanks to lap band surgery.
I'd been heavy all my life, and the older I was getting, the more that it was slowing me down, sort of. And I had a mother that passed away with obesity troubles a couple of years ago.
At that point, Jay knew he had to do something to save his own life. So he talked to a friend who had lost more than 50 pounds after having the operation. The lap band is a weight loss surgery that restricts how much food you can eat.
We feed this tubing around the stomach and then close this buckle down, and it buckles down around the stomach.
The band essentially makes a new pouch for food that is only about the size of a chicken egg.
We can put saline into the balloon, and over time, over a period of about 3 or 4 months, the balloon inflates to a point where they have a pretty significant restriction, and that limits how much they can eat.
In comparison to other weight loss surgeries, the lap band is less aggressive, but there is also less downtime.
Lap band patients have a laparoscopic procedure and go home the same day. The gastric bypass patients are also done laparoscopically, and they stay in the hospital about 2 days.
But don't think that this surgery alone will end your battle with the scale. You must learn to change your relationship with food, too.
The idea is that it's permanent to the degree that a patient can remain compliant and follow the rules. I mean, it's not a quick fix.
You'll also have to plan on visiting the surgeon at least 3 or 4 times a year to keep your weight down.
He'll have to come periodically, maybe once every 4 to 6 months, just to have a little bit of saline put back in.
Doctors use a syringe to inject the saline into the port, which basically appears to be a knot in the stomach about the size of a quarter. It is time for an adjustment when a patient begins to feel hungry more often or can eat a little more.
What we do is we use this sort of as a test. We'll put some saline in and have him sit up with a needle in place, and then I'll have him drink some, thank you very much, I'll have him drink some water, and he'll tell me if it's too tight.
There is a slight risk of infection with the lap band surgery, but doctor and patient agree the benefits outnumber any side effects.
It's medical issues. It's things like diabetes and high blood pressure and cholesterol issues. Those disappear.
I've got a 10-year-old son, and he and I snow skied together this winter, and I would have never been able to have done that. I've sat at the bottom of the hill and watched him since he was old enough to get on a set of skis.